Hey, She Slayers, this is a special sample cut from this week's episode. If you find this interesting, be sure to make time to go listen to the entire episode released this past Sunday. And please be sure to help a girl out and follow or subscribe to this podcast. When does the hormones start to come down in general? Like, when do we start to see things coming down? Which hormones are coming down? And what kind of symptoms do we see with this? This would be like perimenopause, right? Is this what we call?
Yes, exactly, exactly. Okay. So I'm seeing this younger and younger, but I'm still going to say what we have observed for most women
Yeah.
is that in our 30s, the first hormone that starts to decline is progesterone. And progesterone calms the brain and helps with sleep. So sometimes women can experience disrupted sleep, harder to fall asleep, harder to stay asleep. Okay. And then in our 40s, the estrogen production can get a little wonky.
Okay.
It can be a little higher, it can be a little lower, and that
Oh, it
affects
can
our
be higher
mood, it
or
affects
lower.
our cycle. Correct. And then average age of going into menopause is age 51. You mentioned your mom really was a lot younger. That's because perimenopause can be 10 or more years before that last period. Menopause is 12 months without a period, or if a woman has her ovaries removed, then she's surgically put into menopause.
Mhm.
Okay. So that's menopause, but then perimenopause can be years before that. So sleep disruption, mood changes, cycle gets irregular, weight gain, blood sugar challenges, those go together. Adrenals can get stressed out. We have to think about all the other things that are happening when we're in our 30s and our 40s as well,
Well, I know, I'm,
right? A
like,
lot of
thinking
women like
about
career and family.
yeah, these symptoms are like, well, is it perimenopause or is it you own 5 businesses? But there's a test for that, like, right? You is that what you would do for someone who comes in and being like, "Okay, are is the mood changes because you need a vacation or because you're in perimenopause?" So you would just test progesterone and estrogen?
To start,
Okay.
I do a very thorough panel. So the very first thing I do is a really thorough history.
Mhm.
Okay, I talked with a patient this week. She's like, "Your history form's really long," and nobody had said that in a while. So I was like, "Oh, okay.
Thank you.
I'm not going to shorten it, but okay." But I really like lots and lots of questions, a lot of things going on of what's happening in your life. Super. That's point number one.
Yeah.
Number two is a really detailed panel of labs. Yes, for sure. Estrogen, progesterone. There's a test called FSH,
Mhm.
follicle stimulating hormone. That's the brain hormone that initiates the whole
I
cycle
remember
and
that.
easy. Yay. All right. See, super easy to check. Unfortunately, a lot of doctors will say, oh, well, you're having your cycle, so it can't be your hormones. And that's completely not true.
Okay.
So that's where women have to advocate for themselves.
Does
Okay.
FSH go down, up, or is it like estrogen where it could do either? It goes
Like
up
up,
and down.
down, up, down. I call it the stock market phase because it looks like that. Up, down, up, down. So it can fluctuate. It can fluctuate. So we don't really call it menopause until a whole year without the period and the FSH is checked 2 times and stays high both times. But
Okay, so
I have
FSH
patients,
stays high as a result.
eventually it goes up and stays up. That's
And
exactly
what
right.
is FSH
Yes.
responsible for?
It stimulates the ovaries,
Okay.
okay, to make the follicle, which then that's the first part of the cycle. Then if pregnancy occurs, then it goes in one direction. But if pregnancy does not occur, then after the ovulation, there's a little bit of progesterone that is produced, and but then that drops off.
Okay. And does
Okay.
FSH have its own
And then the
set of like
period.
symptoms of like, ah, well, that's, you got a dry vagina or something, and that's totally the FSH, or like is its own type of symptoms that go with it, or are they all so intermingled that it's really hard to
It's that. It's really more they're all interconnected. It's really cool. I absolutely love it. I can nerd out all day on the things that with a woman and her hormones and the cycle. So the FSH starts out really low. And we'll talk about the ovarian cycle, okay, because not all women have a period, okay, but the ovaries, if they have their ovary, then it usually goes through this cycle. And so at the very beginning, the FSH should be low. Then it increases, and then that stimulates. So follicle stimulating
Mhm.
hormone stimulates the ovary to release that egg, and it'll have a spike in the middle. So lots of fertility treatments are connected to FSH, either stimulating more production of FSH or imitating the spike. Okay, so that's a lot more, a lot of detail related to that. And so the symptoms really relate to what's happening overall in the balance between the hormones. So there's estrogen that goes up in the first part of that cycle. Then in the second part, progesterone should be there, but then it drops off, and that's when she's going to have her period. And that's when women experience PMS.
Okay.
PMS, premenstrual dysphoric disorder, PMDD. That's that drop off in all the hormones. Okay. And then we also have testosterone. We women, a lot of people don't even realize that women have testosterone. We do. We don't, men have like 20 times as much as we do or more, but our testosterone level is pretty steady throughout that whole month. So when those other hormones fall below, that's when we might be irritable or a little cranky, and we talk about PMSy.
Mhm.
That's what's happening, is how they are in relation to each other.
Okay. Okay, that's interesting. What does testosterone do through, like, the 30s and 40s in general? Does it stay the
Okay,
same? Does it
yeah. And it declines.
it
It
declines?
declines, and it's nice, and it's a steady decline. And this also happens to men. So for us women, our hormone changes as we get older are more noticeable. And so hopefully we will advocate for ourselves and pay attention and get what we need to feel better. But for the guys, it's very gradual. So sometimes they don't notice it until somebody else tells them, hey, like pokes them on the shoulder, like, dude, you're super cranky. What's you should get checked.
So
Okay, so
crankiness,
testosterone
moodiness is
does,
a testosterone thing too?
that is correct. That is correct. Let me tell you the things that testosterone
Yeah.
helps with. So you then like have not having enough would cause
Right.
these issues. So testosterone helps with mood. It's kind of like a stabilizer. I really think it's the main reason that men look at us women and they're like,
You need to
"What?"
chill, girl.
Yes, exactly. Kind of like a chill hormone.
Right.
Okay, like a stabilizer. Helps with muscle building, which then helps with metabolism and managing our weight. It helps with libido, sex drive. Okay. For us women, again, we're very complex. We have a lot of factors that feed into helping us with our libido. So testosterone is only one ingredient. We have to feel safe. We have to like who we're with. We have to get enough sleep. We have to not have too much outer stress going on. Lots of variables for us, but testosterone can help with that. Let's see. It helps with breast health. It helps with bone strength because it's helping with muscles. So all of these benefits
Do you
prop each
think
other up.
do you think that because I'm assuming we were not giving testosterone or, like, addressing hormones like this in the 50s, 60s, 70s, and, and we have all these women now who are I mean, I feel like in the beginning of my career, I saw a lot more osteoporosis as like a thing. Like, do you think that as we start to take care of the women in their 30s, 40s, 50s, 60s better with hormone therapy, that we might see some like less of some of those types of things?
I do. I definitely think that, first of all, my goal is always women feeling good in her own life. That's like my top goal. But I absolutely think you are right. I think that, well, first of all, like I said, the data shows that hormones lower the risk of breast cancer. So if we can get that word out,
I mean, yeah,
uh,
breast cancer it's through the roof, but I mean, there's multiple factors to that.
that's right. There absolutely are. And so we really want to be proactive and address how we're feeling as we go. And for example, you mentioned osteoporosis and bone density. The US Preventive Services Task Force doesn't recommend a bone density scan until a woman is 65 years old. I think that's nuts. I want women to get a baseline scan by age 50.
Right. And they did
Okay,
just lower
at
the
the
mammogram
latest.
thing though down to like 40, right?
They
And
did. And I
every
am
year.
a correct. Yes, I am a supporter of mammograms. I live in a kind of between worlds in the medical world. My parents are both retired doctors. And so I grew up in the regular medical world, kind of over here. And then over here is the more holistic preventive approach. And I'm definitely more over to this side. However,
That's why you
I live
agreed to
with,
be on this podcast.
I'm delighted. I'm super delighted to be here. I just, again, I'm getting the word out that women can feel good
Mhm.
and not be afraid of these ways to, again, I'm not talking about like the full on that side of the spectrum is like the anti-aging doctors who are doing like high doses of all of the hormones. That's not me either, but I'm on this side because I'm aware. Again, I went into menopause when I was 43.
Mhm. Like
So
into
I've
menopause or you
been
started
into
perimenopause?
menopause, in
Wow.
all the way into menopause. I was writing my first book and I was talking about getting your labs checked, and I thought, I should check my labs. And the FSH level should really, in a woman who's not in menopause or perimenopause, at the beginning of her cycle, the FSH should definitely be below 10,
Okay.
a level of 10, and mine was 54.
Oh, okay.
I'm like, okay, that's very interesting. Glad I checked. Okay,
Okay.
so that was really way up there.